Jason, thank you. Turning now to a full circle special report. Prison sentences have turned into death sentences for more than 200 Florida inmates who died of issues related to COVID-19 in the last year.
Florida has the second highest prison COVID-19 death toll in the country. 19 other states prioritize vaccinations to inmates and staff who often cannot social distance. Florida rejected that recommendation from the CDC.
As I-Team investigator Kylie McGivern reports tonight, the state has yet to issue any plan for prisons and the workers inside of them.
In tonight's special Full Circle report, we talk with a nurse, Union for Correctional Officers, and former inmates about the push against and pull for vaccinating prisoners and staff and the impact beyond the barbed wire to communities like yours. Barbed wire keeping the public at bay, but proving to be no barrier from the virus.
Prisons in the Bay Area are essentially on lockdown, thousands in quarantine because of COVID-19.
More than 17,000 inmates have tested positive in Florida prisons, more than 5,000 staff. The death rate, 1.5 times the rate in Florida.
It is scary to go behind gates with a notion that we are not protected. I was scared about my family, my wife.
Greg Krolikowski is a registered nurse at Zephyr Hills Correctional Institution, working for the state's contracted medical provider, Centurion.
Has there been any plan within the prison you work at to vaccinate workers and prisoners?
None whatsoever. And this is quite frustrating and appalling.
Krolikowski shared his emails with us, going up the chain of command for answers.
How they gonna immunize us?
In December, the Florida Department of Corrections confirmed about a quarter of its population at Zephyr Hills, 150 inmates, tested positive. At least 3 died. Krolikowski contacted higher-ups within Centurion asking for a letter to help him get vaccinated after failed attempts.
I'm 64.
Finally, he says,
I got my first dose.
Krolikowski still worries about the thousands of others still behind the gates.
I'm one of those people who are not afraid to reach out because I see that this is important.
Centurion telling us in an email the Florida Department of Health is the lead in determining the vaccine distribution plan. Centurion has not been provided vaccines to administer to our staff. Centurion says it has now sent all staff a letter saying they are essential healthcare workers and that the company is committed to helping staff become vaccinated. The road from Tampa to Ocala, a reminder that for many, Florida's prisons are out of sight, out of mind, but not for Lorette Phillipson.
You can't walk away from it. You can't forget it.
Phillipson from Pasco County served 8.5 years at Lowell Correctional Institution.
I mean, the plus to all of this is that I'm standing on this side of the fence and not that side of the fence.
That you've made it to this side?
Yeah, exactly, that I made it to this side.
Phillipson works with the nonprofit Florida Cares, advocating for people who are incarcerated.
I would like to see everybody in prison inoculated.
Phillipson sends letters to the women inside with updates on any prison legislation and recent news coverage. One of the recipients, Mindy Fulton, happened to be released after serving a 7-year sentence for drug trafficking while we were there at Lowell.
Welcome home, baby. Welcome home. Yes.
Fulton says she worried about her health inside given her disability.
My hands touch my tires constantly, so I've constantly got to wash my hands.
The state reports 3 COVID-19 related deaths from Lowell.
That was scary, very scary. They've come around and asked people to sign up for the shot, but we haven't seen anything.
The CDC recommends prison staff and inmates be vaccinated at the same time. In a statement, Secretary Mark Inch said Corrections is ready to vaccinate as soon as supplies become available to anyone who wants it, but provided no specifics on who would get first priority, pointing to the state's Department of Health, which over the last month has yet to answer our questions.
It may take a class action suit. That's what they did in New York.
Last month, public defenders and advocates sued Governor Andrew Cuomo, claiming denying inmates vaccines violates their constitutional rights. The next day,
we are vaccinating people in prisons
The state began vaccinating inmates over 65. New York is one of 19 states currently vaccinating prison inmates and staff.
They're vaccinating drug addicts instead of seniors.
In a February news conference, Governor Ron DeSantis stood firm on Florida's approach.
We're looking out for our parents and grandparents here in Florida. There's no way you're going to get some prisoner a vaccine over a senior citizen.
The governor has since opened up vaccine availability to include sworn law enforcement officers over the age of 50. The key word, sworn law enforcement.
It's leaving correctional officers out.
Jim Biardi with the Police Benevolent Association says the pandemic's impact is far greater than the numbers available. 3 correctional officers reported by families to the Department of Corrections dead after testing positive for COVID-19. The number of family members testing positive and community spread from people coming in and out of the prisons, unknown.
Through the whole crisis, the correctional officers stood by and performed their job. And yet their reward for it is they're kind of left off the list of people that would be vaccinated.
Biardi says he's been asking corrections for a plan for when vaccines do become available since November.
There should have been a plan in place for this with such a critical, big agency like the Florida Department of Corrections.
Lot of letters.
Letters to State Representative Diane Hart's office from prisoners, people wanting to be heard.
Respond to every single one of them.
The rep from Tampa,
Because we know that we have elderly people in our facilities currently.
calling on inmates 65 and older and staff to be vaccinated.
It's criminal that we are not ensuring that that staff is protected.
What do you say to people who say, why should I care if inmates are vaccinated or not?
They're coming home every day, being released. So what if they come home to your neighborhood and they're positive? And we've done nothing about it.
In Tallahassee, each of the 55 pins piercing the prisons she's visited,
To remember what happened.
including Zephyr Hills, where Krolakowski wants change for the people he treats.
We need to give them chance to re-enter society alive, not to give them death sentence by not providing medical care.
We will continue to ask the state about plans for future vaccinations as we know the impact it has on you and your loved ones, and we'll bring you the latest information as soon as it becomes available. I'm I-Team investigator Kylie McGivern, taking action for you.